Induce oxidative stress in end-stage renal disease patients by electrolyte-reduced water.
We've had people that were supposed to go on dialysis, not even go on dialysis when they started drinking this water. Yes?
I
Bill?
have a friend that is an MD himself, and he's on dialysis now. So, and I found that when you tell the doctor any of these things, they don't want to hear it.
I know.
Because they're scared to death you're going to quit using their drugs.
I know. That's what it comes down to is money.
Well, did you know MD actually stands for minor deity? That's what it stands for.
I'll have to tell him that one.
Yeah, we've sold machines to a lot of nurses and a few doctors. You know, not a few, but I mean several.
One of them is
mostly we sold to a lot of nurses.
Yeah, one of them is a director at NIH, and one of them is a neurosurgeon, gastroenterologist, a couple of psychologists, actually another doctor too. But they don't share the water with their patients. They don't talk about it. They're not allowed to. If they do, they will lose their license.
That's
They'll
right.
get fined. They'll go to jail.
Yeah.
So I can't talk about it in the hospital when I was there. They won't let me even mention it. It's
Sure.
not, but I can give them all the medication.
Oh,
So
yeah.
it's kind of crazy. But
Yeah, this is Eastern medicine as opposed to Western medicine, you know, and they can't deal with this, give these to the patients and stuff because it's outside of the AMA's doctrine, and you know they can be sued for malpractice or whatever. It's just not what they're taught and what they're supposed to do, but doesn't keep them from drinking it themselves, you know, and all. When someone gets in a bad accident or something like that, and they're taken to the emergency room, first thing a nurse does is puts a bag on, you know, because most people are dehydrated, and it's an easy way to inject medications and different things like that. The first thing a respiratory therapist does, just like Trina, which also goes to all the ER calls, is she takes an arterial blood gas, an ABG, which is just a sample of blood out of an artery, and puts it in this machine, and it gives two different readings. The amount of oxygen in the blood and the pH of the blood. So in Western medicine, they use the pH metric to determine how ill someone is. But that's it. In Eastern medicine, we use the pH to prevent and deal with disease. So they use part of it just to see how sick someone is. Eastern medicine, they use it to treat and prevent disease. So that's kind of the East and the West, the battle going on there.
all right. Any questions from anyone here? Yes, Sheila.
Just a question, how do you know when you've kind of gone from an acidic state to an alkaline state?
You're going to know it. You're going to have energy. Your aches and pains are going to disappear. You're just going to feel it. You will know yourself. It's not somebody else can tell you, and you will know on days when you really slow down drinking the water. You'll feel it. Then you're going to say, you know what? I haven't been drinking enough water. You up your water intake. The aches and pains start going away again. Your energy comes back. Your sleeping is better. You'll know.
There are those litmus strips or pH strips that people, you know, talk about and want to try and everything, but they're not very accurate, and so we've never used them or recommend using them. There's a lot of moving parts to that as well. You don't know how long they've been sitting on a store shelf. Once the package opened, they're oxidizing, and then you have to not consume any beverage or go to the bathroom or anything for at least 6 hours. So most people, check it in the middle of the day after they've eaten or whatever.
Or drank.
So what you do is you wake up first thing in the morning. You should test, whether with the saliva or if you use urine, you're supposed to subtract 0.8 to the reading because the urine is more acidic than saliva.
And you're not supposed to stick it in your mouth. You're supposed to spit into a cup and stick it in there.
And then
don't use them.
Testing one time isn't going to show you anything. Now maybe if you did it over a 2-week or 4-week period or just constantly, then you would have a baseline. You would see change because I don't know how accurate it is and all that. So
if you really want to know, go get a blood gas.
Yeah, which is kind of painful. You're stuck with the needle.
Not really. You're going to know just by drinking the water. You're going to feel it. You're going to know it. You're going to feel it in your head. You're going to feel it in your body. You're going to know what health feels like.
What responds the fastest to the water?
Yeah, one.
Two things that respond very quickly to this water when you drink it, diabetes 2 and high blood pressure. I'm talking like within weeks. If you're drinking enough of this water and staying away from that other stuff, my dad in 10 days was rushed to the emergency room just by drinking the water, and they halved his blood pressure medication. And he's like 79 years old. He's been on it for years and years. So
And
they respond very
those
quickly.
are two of the easiest things to
Yep.
check too, because people with high blood pressure, you can get one of those $50 blood pressure cuffs, and you can check it. And also with diabetes too, the diabetics are constantly checking their blood sugar. You know, and when you
Oh,
see
yeah.
a change in your blood sugar, you know, you can, you know, you don't need that full dose of medication. You can reduce it.
So that's why your dad was rushed to the hospital, because he was taking
Yeah, my
blood
sis-
medication then.
Well, he was taking his regular medication. He's been taking it for like 40 years.
But it was too much.
Well, when he started drinking the
Right,
water, his
right.
body started to heal itself. It started to reach more of homeostasis. And I tried to tell him, Dad, if you start to feel dizzy or anything like that, he's like, he's from Canada. And he's like, oh no, I have to take my medication. My doctor said I have to take it. And I was like, okay, Dad. So anyway, I was there for a week. And then when I left, my sister Cindy came to Winnipeg and was with him. And she phoned me on the third day and said, Trina, the ambulance is here. They're here to take Dad to the hospital. I'm like, Cindy, go find out his blood pressure. She's like, what? She's a teacher. I said, just go find out his blood pressure. They'll know that right away. So she went down there. She comes running back and she's like, they said it's like 118 over like 70. I said, Cindy, he's like screaming and yelling. He doesn't want to grow. His blood pressure should be up around 200 or something. So when they took him to the emergency room, that was the first thing they did was they halved his medication. If he was living around me, he'd be off all of it because I'd be making him drink that water.
The water police, CG, you know.
Of course.
Drink that water.
Question.
But, yeah.
So, does this water, if you have plaque in your arteries, does that help it clean your?
Cholesterol takes a little bit longer, but people that drink this water, yes, they have said that their cholesterol is definitely lowered. So, but it takes longer. If you think about it, cholesterol is kind of like hardening, and so it starts to break it down slowly, so it takes a little bit longer. But your body is going to reach homeostasis. Everybody is different. It's going to do whatever it needs to do to reach that. And everybody's different, but that's what your body is going to try to reach.
And don't get under the impression we're saying this water cures anything. You know, it doesn't. It's your body that's the miracle water.
The
you know.
water's going to clean you out on a cellular level so your own body can heal itself.
What this does is gets rid of all the acids and toxins in your body that's bogging your body down. Your body's fighting acids and toxins instead of disease. So once all that's out of the way, your body's functioning, you know, the way it should, and it's doing what it does best.
I'm going to jump in here and share this because when I got on this water, I guess it was a couple months after I was drinking it, Trina said, you need to read this. And it wasn't this particular version, but if y'all ever heard of this book, it's by Dr. Batmanjali. She was a stomach doctor from Iran, and it's called Your Body's Many Cries for Water. You're not sick, you're thirsty. Don't treat thirst with medication. So I just devoured this book from cover to cover. And some of it has medical language in it, but most of it's very understandable and readable. But in the back, there's an index for all these different diseases, aches, pains. You can go right to the section, and it has a section on high blood pressure, diabetes type 1, diabetes type 2, heart disease, strokes, I mean, like all this stuff. And what I have found, because I've been drinking this water, like I said, for a little bit over 2 years, they've seen a lot more people on the water, but I've seen over 2,500 people sample this water. And I can tell you from what I have seen that what he's talking about in this book happens much faster on Kangen water because it's a superior hydrating water. But he specifically said when he discovered about chronic dehydration and its effects on the body, he actually, Persian, he's from Iran, so it wasn't anything, unique about the water. But he said that when you look in the medical books, every single disease, if you look up the origin, it will say etiology unknown for everything from lower back pain to cancer. It'll say etiology unknown. And he asserts that it is dehydration. I would say it's actually two things, dehydration and overacidity. So if you haven't read this book, they have it at the library. It's wonderful.
We're coming up on a season of flu and common cold, bronchitis, and things like that.
talk to anybody.
Your immune system, when you start drinking this water, is going to be so much stronger. We don't even get colds or sick anymore. If we do start to get a cold, it'll be like for a day or two at the most. That's it.
Trina was
We just, our
worried
immune system
her
is so much
doctor was
stronger.
gonna retire her medical records, you know, put it in long-term storage, so she hadn't been there in so long. She's going, what do I do? I said, go get a physical, you know, whatever.
I had
So-
been there for 2 years to my doctor, and I was on like 10 or 12 different meds. I had, like I said in the beginning, I had arthritis and allergies for 35 years. I was on medication year-round, acid reflux and heartburn, 24-hour medication for that. A lot of different meds, and I was on a lot of pain meds. I even had a neck brace that I would wear because my arthritis was so bad when I couldn't hold my neck up.
She was taking one medication for nausea because one of the pain medications
Pain
gave her
medication
nausea.
makes me nauseous, but
Yeah.
you know what? I am off everything and I don't hurt anymore. It was a vicious cycle that I was on. And anyway, my doctor phoned and they were going to retire my medical record. They thought I moved, and I'm like, no. So Bobby said, go get a physical. And when I went there, my doctor kept saying, I don't understand. He's looking at my record. I don't understand how you can be off all this medication. It doesn't make sense. And I just said, I don't need it, Dr. Kubicki. I just don't need it anymore. He said, you can't be. It doesn't make sense. How can you be off this? And I told him, I said, I started drinking this Kangen alkaline water, and I don't need it. He just said, doesn't make sense. So anyway.
Right.
Do you, I heard you say you drink coffee and you have wine. Do you drink anything else, or is the water the only thing that consumes
Well,
your life?
we have beer and vodka.
Well, juice, you know, juice and different things like that. You know, even, you know, you go fly somewhere. You go through TSA and then you're in there without your Kangen water. You know, yeah, I buy a bottled water and drink that too. It's not as acidic as those groups down here in this range, you know. It's something you saw, it takes a little bit of Kangen water and poof, you know, it changes it back. So yeah, I mean, you got life. Ideally, I would have one of these machines set up right in my vehicle, so everywhere I drove I had fresh Kangen water. But it just doesn't happen like that, you know.
We
So, you
we
know,
drink other water
you
when we have to. But
avoid the really acidic stuff, and
Yeah.
all the rest, you know, is easily dealt with. You
we
know?
drink
Yeah.
we drink other water like at the airport or whatever when we have to. But when we travel, we bring the machine with us. We have put that ST501 in our backpack and brought it to Costa Rica twice. We just carried it on the plane, brought it to St. Lucia. We bring it all over the United States and Canada. We hook up to hotel rooms. We have even hooked it up to a garden hose, and it worked. So it's pretty incredible. We bring it everywhere we go.
Does a solid change its state, like if you were to make ice out of this?
Well, we actually do make Kangen ice cubes with it. So, and then when I melted it, it's still alkaline, and I can't remember, it's got a small negative charge to it still, but it's still, and it freezes really fast.
And dense.
And it takes
Very
a
dense.
long
So
time
if you
to
chew
melt.
ice, it's not a good ice cube to chew on. It's like
Yeah.
eating a rock. You
We,
know,
when
so.
we were playing in a volleyball tournament, I had frozen a whole gallon in the freezer, and I gave it to a friend over, and we were out, and it was 94 degrees that we're playing sand doubles. And that sat outside the whole day, and by the end of the day, at the end of the tournament, it still had not melted. There was still a huge, big thing of ice in there. It takes a long time to melt compared to regular ice. It's pretty good.
So you can be a Kangen water purist. I don't know if you see the martini glasses back there, you know, and we shake them up with martini ice cubes, and a little dash of water in
With
there.
Kangen ice cubes.
Yeah.
Martini ice
Yeah,
cubes.
Kangen ice cubes. Yeah.
I know, martini ice cubes.
That's a good idea.
Yeah. But anyway, that's it. You
But
know.
this is a good thing too, is that people who drink this water, they know what it's like to be hydrated and to feel good when you're on it. So there is a Kangen water share map so when Bobby and I went to Scotland a few weeks ago, I went on the map and I contacted somebody who lives in Scotland, and there's only 4 distributors in all of Scotland, and he happened to live 10 minutes outside of Glasgow, and that's where we're flying into, and talked to him, and he said yes, and he met us, and he came to our hotel and brought us water twice. It was amazing. So there's people all over the world, the Kangen people, that will share their water with you. I'm telling you, the world.
Yeah.
So it's pretty amazing.
Yes, they-
Yes, Bill?
You've experienced relief from arthritis, and I
Yes.
only recently found out why my hip hurts so bad. I've got arthritis. Of course, I'm a little older than anybody in here.
She's 97.
Yeah, I thought so. Have you had any input from someone who has like chronic fatigue syndrome?
Well, what's another name for chronic fatigue syndrome? Just you're tired all the time?
Yeah,
I don't know. Well, let's just say that everybody says their energy increases when they're on this water. That's a
Okay.
given.
yeah.
So
And
I would think that is right along the same lines.
A lot of people, you know, we deal with all different types of people all the
Of course.
time, you know, with this being exposed to people, and a typical thing would be, I can't give up my diet Pepsi, you know, I need that jolt of caffeine in the afternoon, you know,
Right.
when I'm starting to get run down and all of that, and you know, we can say, look, you're gonna get, all you gotta do is drink this water, and you're
Yeah.
gonna get energy. It's gonna give you energy, and it does. People are really surprised with that.